The United States has officially withdrawn from the World Health Organization, leaving the United Nations agency without one of its biggest donors. The WHO says the withdrawal is a loss for both US and global health. Well, Dr. Omer Awan is a physician and senior public health contributor for Forbes. Dr. Awan, a very warm welcome to you. Speaking as a doctor, a physician, your reaction first to the United States withdrawing from the WHO.
Thanks for having me. Well, as a physician, I'm very disheartened about this decision when you consider just how important the World Health Organization is on the global stage. I mean, we're talking about the leading global health organization that is responsible for coordinating disease surveillance across so many different infectious diseases. It's responsible for setting vaccine standards, and it shares transparent, important data all across the world. So this is important to keep not only Americans, but the world safe. And without the United States participation, I'm afraid that we are less safe and less healthy without the World Health Organization.
Well, now the United States has withdrawn. Where's the cash going to come from?
It remains to be seen, but I suspect that they'll have to get creative ways to get donors. So we already have had, philanthropists like Bill Gates that have donated a significant amount of money, but they'll have to tap into other national organizations and other philanthropists so they can make up the deficit. Remember, the United States funded about 17 to 18% of the annual budget of the World Health Organization. That translates to actually billions, not just millions, but billions of dollars throughout the year. So it is going to be a hard ask to reach that milestone.
Let's put the cash to one side for a moment and let's talk about health. Can you say which areas of international and public health will perhaps suffer the most?
Well, I believe what's going to happen is that in the United States, for example, we're going to have delayed warnings of future outbreaks. Things like if Mpox or Ebola or even the flu are spreading, we won't get warned as fast as we probably should. The other is, which we often don't talk about, is vaccine development. So one of the critical aspects of the World Health Organization is to gather and collaborate with different countries about the development of vaccines, like the flu vaccine, for example. And if the United States is not part of that conversation, then it's possible that the flu vaccine may not be as effective as treating or preventing the strains that are circulating in the United States. So that obviously, of course, makes us less healthy and less effective at combating the flu. And of course, we won't be prepared for a future pandemic should one occur, because the World Health Organization plays a crucial and critical role in preparing all of us for pandemic.
And do you really think this is the end of it? Might the United States one day, in another life, perhaps under another administration, return to the WHO?
Well, I hope so, and I think a lot of this has to do with the current administration. So when we have future administrations, they may see the value of the World Health Organization, particularly for what it's done. I mean, we're talking about an organization that has dedicated millions of dollars to life-saving vaccines that have helped very low-income countries, places like Africa, Southeast Asia, that have prevented deadly infectious diseases, things like polio, for example. So I do suspect that future administrations will see the value of the World Health Organization, and hopefully America will return one day.